Hello everyone, this is Dr. Nasser, and in this clip we are going to discuss hairy cell leukemia. Hairy cell leukemia is a leukemia that is important to diagnose because it appears very similar to lymphomas, and it is important to determine whether or not this is a leukemia or this is a lymphoma because the patient's treatment depends on that identification. In this smear, we are at low power, and I do see two white blood cells appear to be large lymphocytes at this magnification and a neutrophil in here. Of course, I would not differentiate these cells until I go to higher magnification. However, I notice ROLU. There is ROLU present here, at least 2+. And when we travel to new fields, you can see that ROLU is still present. So I would definitely make a note of the ROLU. However, this is hairy cell leukemia, and hairy cell leukemia needs to be closely observed in order to be able to not miss the characteristic of these cells. Again, hairy cell leukemia is a type of leukemia, is a B cell leukemia. As you go through the field, you may be able to see cells that if you don't pay attention, you may think they're normal, but they are not. In this field, we have a lymphocyte. The size of lymphocyte is not very big, relatively small, perhaps 1.5 times of a red blood cell. And there is a basophilic cytoplasm in here. But the key are these projections that are coming out of the lymphocyte. So that is something that you should keep close eye on. If I look for other cells as I go through them, I will tell them what I think they are. This is another lymphocyte with the nucleus pushed to one side, basophilic cytoplasm, scant cytoplasm. However, these are the projections that you need to pay attention to. Now I become suspicious. I have seen two cells with these characteristics. I would like to continue looking at other cells. There are two segmented neutrophil in this field. They appear to be normal looking. Perhaps there is some toxic granulations present here. The cytoplasm appear to be a little bit basophilic. And then you come across this cell. And this cell, now you should be able to identify this smear a suspect for hairy cell leukemia, because this cell is different. I would like to increase the light and then decrease the light. Pay attention to the appearance of the nucleus. This is not your lymphocyte looking nucleus. So this cell is not only large, but still has that basophilic or sometimes non-basophilic projections out of the cytoplasm. So on this smear, I will definitely make point regarding the presence of hairy cell on my final report, because that is very important information. And then follow-up studies can lead to exact diagnosis and treatment for the patient.